I start speaking, and then Armand. So if everyone is ready, we good? Okay. Going to go ahead and admit everyone. Welcome to the Cuyahoga County and Board of Health media briefing. We are joined by County Executive Armand Budish, Health Commissioner Terry Allen, Medical Director Dr. Heidi Gullett, and Co-Director of Prevention and Wellness, Ramona Brazil. We will start with Executive Budish, then go into some questions from the media. Executive Budish, if you'd like to start us off.
Thank you, Devin. Good afternoon, everybody. As always, I really appreciate having the chance to fill you all in on what the county is doing to help people get through this COVID-19 pandemic and the economic crisis. For a comprehensive review of what your county has been doing for you, get strong together online at cuyahogacounty.us/strongtogether. It's amazing how much we've done in just a few short months, if I do say so myself. I want to thank Director Terry Allen, Dr. Heidi Gullett, Ramona Brazil, and all the folks at the County Board of Health for their tireless and stellar work to keep us all safe and healthy. I want to start by highlighting a couple of programs that we're doing now to help people find jobs and to grow their businesses. And I want to share some steps that we're taking to ensure a smooth election process. We know that many people lost jobs because of the shutdown. This has created terrible strain and terrible pain around our county, particularly as the federal government continues to be stuck in an impasse over any additional support. Our June unemployment numbers show that we're at 15.2%, which is better than April was when we were over 23%, but it's still painfully high. And if you're one of the many people who are out of a job, the statistics don't matter. What matters is the fear over whether or not you can pay your bills or put food on the table for your family. But there is good news. Right here in Cuyahoga, we have thousands of open jobs available, good paying jobs. And we're here to help by connecting job seekers to local businesses. We're partnering with the Cleveland-Cuyahoga County Ohio Means Jobs to host virtual job fairs over the next months. We did our first job fair about a month ago, and it was very well received by everyone involved. So we're doing it again. Job fairs are great ways for employers to connect with job seekers. But because of COVID, we can't do them like we used to do, which is face-to-face. So we'll do it virtually. The next fair is next week, and Ohio Means Jobs has got more than 40 companies lined up. Companies as varied as Our House, University Hospitals, Lincoln Electric, Dave's Markets, Carvana, and more. There are tons of jobs available in all different fields. You just need to register and participate. The virtual job fair takes place Thursday, August 27th, and Friday, August 28th from 10 a.m. to 2 p.m. All you need to do is go to Ohio Means Jobs website at omjcc.us. You can register there and you can get connected with local businesses. Okay, the next initiative I want to tell you about is the lab. Some people will take advantage of the disruption caused by the pandemic by starting a new business. And again, we want to be there to help. In the midst of this pandemic, we're seeing entrepreneurs who have great ideas. They just need some support to get their business off the ground. We help entrepreneurs in many ways, including funding partnerships with Jumpstart, ECDI, the Urban League, and others. Our Department of Innovation and Performance has a new program called The Lab at Cuyahoga County. The lab works with local entrepreneurs who have ideas that they want to test and grow in a real-world environment. This is important because trying out a new product or a new service is often the hardest part of launching a business. You may have a great idea, but you need to be able to test and refine it with people and organizations that need the service. That's where the lab comes in. We started the lab up with local partners, including the Metro Parks and Cleveland Public Library. All three of us are lending our expertise and providing the opportunity for local companies to test their ideas. Here are just three of the companies we're already working with. There's a company called Roadprints, which uses advanced robotics, geolocation, and sensor technology to put down markings on the street, like turn arrows or bike signals. They don't use stencils. Why is this important? Because local governments spend millions of dollars doing things like road striping. And a solution like Roadprints could help cities save a lot of money while avoiding injuries to road workers. Next, the Unbail Project is a simple, interactive platform that guides defendants through the criminal legal system, which can be very confusing and difficult to navigate. This effort lines up with the county's focus on criminal justice reform. Another company that the lab is supporting is called Evergreen Partners. Their mission is to turn unused indoor space into automated hydroponic farms so that they can empower communities to become food independent. When the county declared racism as a public health crisis recently, one of the areas we pointed to as a real concern is the lack of access for many of our neighborhoods to fresh, healthy food. Evergreen Partners is working to change that. I'm grateful to our partners at the lab and looking forward to seeing these and other local entrepreneurs grow and thrive in the coming months. Next, I want to give an update on our Connecting the Unconnected efforts. Cuyahoga County has a pretty bad rate of connection. 25% of our residents are not connected to the internet. Think of the impact this has on people looking for a job. Think of our kids who are expected to have connections so that they can attend school virtually. We can't let them get left behind. That's why we've put millions of dollars of funding into correcting this. We've partnered with PCs for People, which is starting to distribute computers and hotspots with 2-year free subscriptions to the internet for families with K-12 students. So far, the county has obtained and is distributing 21,500 computers and 13,500 hotspots. Families can sign up online at pcsforpeople.org/Ohio. That's pcsforpeople.org/Ohio. Or they can call 216-930-5741. Pickup locations are available across the county at participating Cuyahoga County libraries. We appreciate the support of Eaton, GE Lighting, Squire Patton Boggs, and other businesses that have stepped up to donate computers and other technology. Anybody, you can donate a computer to help fill the need that we have in this community at participating Cuyahoga County libraries. And corporations can receive free pickup and certified data wiping services from PCs for People by calling 216-600-0014 or email cleveland@pcsforpeople.org. I want to thank everybody for their help on this. Finally, I want to address our upcoming elections. Because of the pandemic, the November election will be like none we've seen in our lifetime. Many of us will be voting by mail to avoid lines and to avoid other people on Election Day. But many people will still want to cast their vote in person, and that's okay, that's your right to do. Here's the problem. Our Board of Elections is predicting that we're going to have a real shortage of poll workers. The poll workers who have been doing this for years tend to be older. Now, because of COVID, many of them are worried about their health and may just not want to work the polls in November. So we need an influx of workers to help staff the polls. This is urgent. Without enough poll workers, polling locations may have to be consolidated and closed, and the resulting delays are likely to be horrendous. We just can't let that happen here. That's why the county is teaming up with the Cleveland Cavaliers to give our employees the opportunity to take the day off work with pay to work at the polls. And we're urging other businesses to do the same. This week, Cavaliers CEO Len Komorowski and I sent a joint letter to many local business leaders asking them to follow our example. And I'm asking again, if you're a business leader, you have the ability to help make our election go smoothly, to help avoid long lines, and to keep polling locations open. So please join us and join the Cleveland Cavaliers and make it easy for your employees to take the day off to work at the polls. And by the way, your employees will also get paid $250 by the Board of Elections for working at the polls. If you're an individual who wants to work at the polls, or if you're a business leader who wants to help, call the Board of Elections at 216-443-VOTE. That's 216-443-VOTE. Now, for those of you who don't want to vote in person and prefer voting from your home, I have some strong advice for you. Get your ballot application in now, right now, today. You need to go to 443vote.com and click on the Vote by Mail link on the left-hand side of the page. Request your ballot now. The Board of Elections will begin mailing out ballots on October 6th. And then once you get it, immediately fill it out and mail it back. We've all heard the concerns about the post office. The post office can handle the volume, even at record numbers, but we need to give them as much time as possible. So go to 443vote.com and request your ballot. And once you get it, send it back immediately. That should leave plenty of time to get it to the Board of Elections. Before I turn it over to Commissioner Allen, I want to say that I'm grateful to all of you for working hard to follow the health guidelines that are put out by our Board of Health and Governor DeWine. As you'll hear from Director Allen and Dr. Gullett, our numbers are getting better. In fact, yesterday, the governor announced that we were an orange county. No, not the OC, like on TV, but we're still Cuyahoga County, don't worry about that. But seriously, I know that masks, social distancing, and all the other stuff we're asking people to do, it's a pain, but it works. If we want to get out of this with our economy and our health intact, we need to keep it up. Thanks to your efforts, we're winning the battle. But especially with some schools starting back up, we need to keep up the fight. We cannot stop now. If any group of people can do this, it's us. We know what it is like to struggle against adversity. We're in this for the long haul. Let's stay strong together. Thank you. Okay.
Thank you,
Terry.
Thank you, Armin. I'm glad that you mentioned the Evergreen Partners, Armin. I have had the good fortune to go to the greenhouse and visit, and it's a great job creator. And they actually have a lettuce there called Cleveland Crisp, our very own Cleveland Crisp, and you can buy it at area grocery stores and support that great local business. So as always, thank you, Executive Budish and your team for your collaboration in this pandemic response. I wanted to mention today that your team at the County Emergency Operations Center continues to be a fantastic partner in assisting with mask compliance. And by the way, I should thank the executive, his support in dealing with a opportunity to for people to report their masking experience, and also to report cases where people aren't masking to the degree they should. That is having a big difference. And our work locally is making a difference, and we're seeing people masking at much higher rates. And I think that is in no small part of our good news today. And also the folks at the Community Emergency Operations Center have been working with us with our school systems as we work to gather information to make good decisions as we go forward through this very uncertain time. So thank you very much. So we have a water line break here at our building, and we've been dealing with those issues concurrently. And so our co-director, Ramona Brazil, co-director of Prevention and Wellness, Ramona Brazil, and Dr. Heidi Gullett are here, but I'm unmasked. We're all unmasked, which means that we're not close to each other, but we're here to participating and working through a little bump in the road here at the building. So on August 20th, Thursday, August 20th, Governor Wine announced that Cuyahoga County would be moving to risk level 2, a public health emergency, or orange, in the Ohio Public Health Advisory System for the very first time since the advisory system started. Counties at risk level 2 are advised by the Ohio Department of Health to exercise a high degree of caution. This is certainly welcome news and an indication that our community is beginning to move in the right direction. More people are wearing masks, as I mentioned, and we're noticing that too as we visit businesses and restaurants and the like during our normal inspection processes. And many of you may be noticing it too in the community. These masks work, they save lives, they prevent cases of COVID, and it's a best practice. So we also know that physical distancing and hand hygiene and surface cleaning and remote work and staying home when you're sick are all part of that prevention equation. Our continued vigilance in following the prevention guidance is essential. We have seen counties move back and forth between red and orange in the state public health advisory system reports, sometimes a week apart, making it clear that seeing decided trends, clear trends over time in a positive direction is very important for decision making to understand the trajectory of the pandemic. As of yesterday, countywide, including the city of Cleveland, we had 14,673 cases of COVID-19 that have been reported in Cuyahoga County. About 9,300 of those are in our jurisdiction. Across the entire county, 15.7% of these cases, over 2,300 people, required hospitalization. And that is by far the highest number in the state of Ohio, higher than Franklin County or our other peers in Hamilton County. Of the total cases in the county, around 4%, 544 people have died, all in the last 6 months. And Dr. Gullett reminds us that these are folks with families, friends, neighbors, relatives. These are people in our community that have died. And by comparison, we had an elevated rate of influenza in our community in the 2019-2020 season, and we saw less than 50 fatalities in 6 months. This is an unprecedented pandemic in our lifetime. And so we still have some time to go. So it's important to pause and recognize that we've had members of our own community, the Cuyahoga County community, die, and in no small numbers. It's clear that this coronavirus spreads easily and people without symptoms can unknowingly transmit the virus to others. Infectious diseases don't recognize or care about borders. We've learned from our case investigations that people move around widely across the region and beyond, with exposures often happening outside the immediate community where a COVID-19 case may live, demonstrating the interconnectedness of Northeast Ohio and the rest of the state. We also see that people go on vacations in other states and may be exposed and bring that back home. During the governor's briefing on August 11th, he stated that about 25% of changing gears, as the governor stated at his briefing on August 11th, about 25% of the state will start off the school year remote, mostly in high population counties. He also noted that whatever level of transmission is happening in the community will happen in the schools. And we know this to be true from our experience here in Cuyahoga County. At that briefing on August 11th, the Nationwide Children's Hospital Research Institute presented some combined data from the children's hospitals across Ohio on testing of kids for COVID-19 over the last 5 months. And they shared the following information. And I would encourage you, if you haven't seen it, to go back and watch that August 11th briefing. We've learned certainly, and we know this, that children get sick with COVID and can transmit to others. Their data from the children's hospitals indicate that thankfully most kids do well, fairly well with symptoms, about 90%. However, about 10% of these children are sick enough to be hospitalized, and those with underlying medical conditions have required treatment in the intensive care unit. Among all the children's hospitals, they have conducted about 14,000 COVID tests in kids over the last 5 months who have had symptoms consistent with COVID. Among that population, about 8.6%, or over 1,200 kids, tested positive for COVID. They've also tested an additional 20,000 children that did not have signs or symptoms of COVID, or asymptomatic children. These kids came to the hospitals for inpatient or outpatient procedures over the last 5 months. Of that 20,000 population of asymptomatic kids, about 1.4% tested positive. This rate has been rising over the last month, and as of August 11th, that rate was at 2.9% among asymptomatic kids. Older teenagers, age 17, are the highest rate of positivity among all children. It makes sense because they move around a lot more than certainly the younger children do and interact in the community at a much higher rate. In terms of severity, 8% of COVID positive kids have required admission to one of Ohio's children's hospitals, and 1% have been very ill and required ventilator support. So COVID can be very serious illness for children. Obesity, diabetes, and other underlying health conditions can also increase risk for adverse situations related to their COVID course of the disease. On August 15th, the Ohio Department of Health stated that they'll be following federal guidance and prohibiting the school-wide use of face shields as a substitute for facial coverings and masks. The Ohio Department of Health stated that such use of face shields doesn't comply with the director's order requiring the use of facial coverings in child education settings. The CDC recommends against using face shields as a substitute for facial coverings or masks. We certainly understand that there are special situations where an adult or student may not be able to wear a face mask. In those instances, face shields are a practical solution and are acceptable. The use of masks or face coverings is intended to reduce the spray of respiratory droplets from the wearer into the environment and onto other people or onto surfaces. The mask or cloth face covering, as we know, should cover both the nose, the mouth, and also include the chin with little or no gap. On August 18th, Governor DeWine stated that he would allow both contact and non-contact high school sports to continue this fall with guidance provided for operation of these activities. We're working with our schools in reviewing the details of this order. Spectators will be limited to a small number of people close to the athlete, marching band members or other participants. Schools will determine who is allowed to attend. There'll be people on site at contests to assure that social distancing and other prevention measures are followed. Several schools are also proposing to move fall sports to spring as an option. Students won't need to be tested to participate in sports. Each school district will appoint a compliance officer to implement the state guidance and assure compliance. The governor advised that schools in areas with greater spread should, quote, think long and hard about having contact sports. He said these are all tough decisions, and indeed we know that. There's not necessarily a right or a wrong answer. He said that we just ask everyone to weigh everything, make the best individual decision for that child, for that team, and for that school. The Ohio Department of Health order states that the risk of spread increases the more an athlete interacts with other athletes, the closer the physical interaction of the athletic participants, the longer the interaction, and the more sharing of equipment there is by multiple athletes. Board of Health recognizes that these are indeed difficult decisions for all school districts. We clearly recognize that education and extracurricular activities are very important for a child's mental and physical health. And we also understand the importance of resuming in-person activities when it is safe to do so. On July 30th, you'll recall our agency released COVID-19 recommendations for K through 12 schools in our health jurisdiction. These are for schools that are outside the city of Cleveland proper. For the upcoming school year, in this guidance, released with the support of our board members, we recommended that schools begin the 2021 school year operating remotely and that schools discontinue sports and other extracurricular activities during the remote learning period. As school districts reviewed the recommendations and their plans, we recognize and respect their responsibility to make the decisions that best meet the needs of their respective school communities, and many have done just that. To be clear, these are recommendations and they are not Board of Health orders. These are recommendations designed to provide evidence-based guidance, and they are developed in response to requests from many school administrators for public health guidance from us. We understand that schools may exercise their discretion as they work through their final decision processes and understand that they may choose a different path. In any case, the Board of Health remains committed to work with all our schools as they implement their final plans, and we continue to meet with school superintendents on a regular basis in collaboration with the Educational Services Center of Northeast Ohio. This month, we're providing 3 trainings for school officials related to food safety, environmental and facility health and safety, and contact tracing. We've had great attendance as schools work with us to learn and prepare. Board of Health will also continue to support schools by providing surveillance, outbreak investigation, and contact tracing for any outbreaks that are detected in the school environment. And we're currently working on a number of cases and working with schools on contact tracing on a number of return to sports events. As I mentioned earlier, we've seen counties move back and forth between red and orange in the weekly state public health advisory system, making it clear that trending in one direction over time is important for decision making. Taking into account all these factors, the Cuyahoga County Board of Health maintains its current recommendations for schools. As we move forward and consider any future modifications to the recommendations, the following factors will be considered along with our school districts, and they include positivity rates. We need to see a sustained decline in our COVID-19 positivity rates below 5%. When we say sustained, that means over multiple weeks. So we know that we aren't bouncing back and forth, and we have a sense that we're headed in a clear direction, in a positive direction. We also need to see a sustained decline in new case reports over a month period. And you'll see from our data, certainly, that we've declined from that peak that we saw between mid-June and mid-July, but we're still coming down from what was an excessively high number of cases. We also want to see that in our state public health advisory system, our risk rating of orange or 2 would remain so over multiple weeks, which includes a sustained improvement in the metrics that relate specifically to our health jurisdiction. Also, as I've mentioned before, and certainly Director Brazil and Dr. Gullett have mentioned, COVID testing capacity for children is very important. And right now we still lack the necessary testing capacity for kids. And this includes symptomatic kids. It's a challenge right now. And so it dramatically complicates our outbreak response in the school setting, and the lack of testing limits our response to a symptom-based investigation. We face these significant challenges even as flu season is just around the corner, and we anticipate that COVID-19 and flu will circulate in our community at the same time. If there ever was a year to get a flu shot, this would be it. Thanks as always to our incredible staff and partners, to Director Brazil and to Dr. Gullett and all the people of Cuyahoga County that are living through the challenges of this pandemic. This is tough for everyone. And if we stick together to protect each other, we can get through it all. Thanks for your time and attention, and I'd like to turn it over to Director Brazil.
Thank you, Terry. First, in the tradition of Dr. Gullett, I would like to start by sharing some gratitude and appreciation today. So I would like to thank our ever adaptable Board of Health staff. Today, we encountered an unexpected disruption to our building operations, and that meant that we needed to take our regular operations as well as our COVID operations fully remote this morning. And that happened pretty quickly and pretty seamlessly. So I continue to be proud of the work that we do and the way we do our work under any condition, including flooded parking lots and driving through mud, in our efforts to meet the needs of our communities that we serve. So I am working from home this afternoon, and I'm hopeful that my dog will cooperate for at least the next 5 to 10 minutes. So secondly, I would like to acknowledge the pain that this pandemic has caused in our community. From homes. So just to quickly give an overview of what that process looks like. When we receive notice of a positive case at a school, we will work with the school to identify close contacts of the student or staff member. Positive persons would be required to isolate at home for at least 10 days from the onset of their illness, or test date if they have no symptoms, and would have to be at least 24 hours fever-free or have significant improvements in symptoms before they could return back to the school setting. We will place those who are in close contact in quarantine, and that would be for at least 14 days from the date of contact from a person with COVID-19. We are following guidance from the Ohio Department of Health and the Council of State and Territorial Epidemiologists to determine if there is a cluster outbreak in schools. So a cluster has at least 2 lab-confirmed cases of COVID-19 that can be linked together with a common exposure and occurs within a 14-day time frame. And that's considered to be the incubation period for COVID-19. This definition is important. We can have multiple cases at a setting that are not related outside of that time frame we just talked about. So although they both may be positive, they may not actually have the same exposure source. And so an example where we might actually have a cluster are people who do have a common source of exposure. So it could be playing together, riding in a car, or sharing a drink. So when we do our investigations, that's part of the work that we do, is to try and understand how that transmission is occurring. And that helps us to determine what kind of measures need to be put in place to try and reduce the spread of COVID-19. So that's where we would work with schools to help us identify that and then put in place whatever we needed to minimize that spread. We understand that this is a difficult time for parents and families. I'm a parent of a young child myself. And we do encourage staff and families to continue to cooperate if you are contacted and be open about potential exposures. We understand that this can be very scary, but it will be necessary to minimize the spread of COVID in schools. So, we've already had a couple of stories of athletes who may not have wanted to cooperate with contact tracing or their families because it means they can't play that sport. But we understand that the danger is if people continue to play and they get sick, that they can get a lot of people sick. So it is really important to be open and transparent about potential exposure. We also have seen some national examples in colleges returning to campuses and the social interactions outside of school that are thought to be contributing to its spread. We also saw that when many businesses opened up. So people may be mindful while they're at work, you wear your mask, you stay socially distant, but kind of let their guard down after work. And so things like riding in a car or sharing a cigarette or a drink. So I would like to remind staff and families to also be vigilant outside of the school setting to minimize spread. With that, I will turn it over to Dr. Keller.
Thank you so much, Ramona. So I'm going to spend a few minutes reviewing our data, and then we'll hand it back for questions. So looking at our Epi brief this week, you already heard Terry and Ramona talk about the new cases this week. So we had 591 new cases, as you heard Ramona discuss, and that crested us over 10,000 cases this past week. And you can see the breakdown here. We also had an additional 14 deaths, and I never ever want us to get comfortable with just looking at these as numbers. Every case, every loss of life, every person in a hospital, every person on a ventilator, every single one of those are people, and their lives are really impacted, as are the lives of their families. So we grieve with those 14 families from this week, as we've had 433 in our community, and you heard 544 in our Cuyahoga County community, with Cleveland included. And that's a tremendous loss of life that continues. And so we will continue to report out as often as they are reported to us. Moving down, looking at additional case demographics, you can see that male-female breakdown, and you can also see the age distribution. 38% of our cases remain in the 20 to 39 age group. So that's a pretty significant volume of cases in that age group. We just want to remind folks that it's affecting everyone across the age spectrum. In the 80 plus range, that includes people in their 80s, 90s, and 100s. We have a very high number of people in their 100s in this community, and we continue to have them reported to us with positive cases. So really important to recognize people at both ends of the age spectrum, but also the significant number of cases in younger individuals. You can see that the breakdown for race of all of our cases at this point is 46% of cases identify as white and 40% as Black. 7% is unknown, other 6% people identify as that category, and then 2% is Asian. And just below that, you'll see our ethnicity, with 3% of individuals identifying as Hispanic, Latino, or Latina. Our number or proportion of healthcare workers of the overall number of cases or percent of cases is 17%. You may remember back what seems like 3 or 4 years ago, which was really just like 5 months ago, the case of healthcare workers was much higher. It was in the mid 30%. And that was because that was mostly who was being tested early on and where we saw a lot of transmission happening. And then through the amazing support of our county executive, county government, and our hospitals, we were able to get additional PPE, and infection control practices were enhanced. And so we see much less transmission happening in the healthcare setting. And this also is a reflection of us now testing way more people out in the community. So it's good to see that that number is lower. You'll see that about 37% of our overall cases since the beginning have pre-existing conditions, meaning conditions that put you at higher risk for obtaining an infection. So things like diabetes or cancer or heart disease and many others. And you won't see it here, but our most recent data analysis, thanks to our amazing data epi team, is that about 60% of those who have lost life in our jurisdiction, so those who have died, 60% had pre-existing conditions. But that leaves another 40% who've died who don't. And so I really want to use this to say, yes, pre-existing conditions make you at much higher risk for being hospitalized and needing an intensive care and needing a ventilator. But people without pre-existing conditions are also very susceptible to this infection, as well as to the ultimate complication, which is death from this infection. Jonathan, you can move down lower. Thank you very much. This is our Epicurve, and every week I continue to be amazed looking back to the end of February, when our first cases were diagnosed at the beginning of March but had symptom onset at the end of February. This is a lot of work and a tremendous amount of work, and I want to again underscore the gratitude that Terry and Ramona expressed for our amazing staff at the Board of Health, as well as our partners in local health departments in our region and across our state, who've worked really, really hard to keep this curve flat. But you'll see July was not a flat curve, and we're very grateful that we're coming down, but we still have a very high number of cases weekly. We had about 75 cases on average per day this week, each day, as compared with over 100. We had as many as 168 in one day in July. So you can see we're definitely steadily coming down. And we want to give kudos to our community for wearing masks and social distancing and doing everything you can to help us get through this as quickly as possible. But please don't take your foot off the gas. Please continue to do all of these things, because as quick as this is coming down, and it's really slowly coming down, it can go right back up. And we want to just, not lead with fear. We're trying to lead with evidence and data, but we really want people to know that we still need you to do these things, particularly as it gets colder and we move inside more. We're spending a lot of time outside right now, which really helps dissipate transmission between person to person. But as we move back inside, we're going to be again in closer quarters. Moving down below, you can see our weekly map. This is the zip code map that we've been presenting since March. And this does include the city of Cleveland. So you can see all of the zip codes in their entirety in the county. Moving down. The hospital utilization data for this week is relatively similar to last week. You can see that adult medical surgical beds are at 85%, just a slight decrease from last week. We have critical care beds at 81%, pediatric beds utilization at 58%, and ventilator usage for adults at 41%. And again, we present this as just one more piece of context, one more piece of information to help you understand what is going on in our community. Not all of these beds are being utilized by people who have COVID, but when you have a pandemic or you have an outbreak, it's critically important to understand what capacity you have should you have a surge of new infections, like we unexpectedly saw in July. So this represents people who are admitted in our county. This does not represent people who are only from our county. We have quite a bit of hospital capacity here. So people are transferred in, people come here to seek care. So this just reflects the beds that are available at present. And we'll continue to track this as we move forward. And finally, looking at the very bottom, you'll see this is the cumulative or aggregate hospital testing data between Cleveland Clinic, Metro Health, and university hospitals that we present every week. This does not include the private labs like those that your private doctor's office might send out, nor does it include pharmacy testing labs. So this shows that we have a percent positive that's decreasing this week. We were as high as 9% in July for 1 week. So you can see that this is a marked improvement. We're very pleased with this. You can also see we've been hovering around 20,000 or so tests per week between these three hospitals, which is excellent. We've been as high as roughly 22,000, and we've been a lot lower when testing capacity was building up. Our hospital partners, we meet with them at a minimum weekly, but usually a lot more often than that. And they are working tirelessly to get more testing capacity in this community, including for children. Everybody understands that. Our state officials, our hospital partners, we're all working as quickly as we can to increase capacity and numbers going into the fall when we know we'll have influenza also circulating. I also want to just recognize that this percent positive can easily change as well. And this also represents people without symptoms, those asymptomatic people who are getting tested before procedures. So in some hospitals, you need to get tested before you have a procedure, probably in all of them at this point. So a large number of these tests are also people getting procedures who are asymptomatic. So recognize that this isn't just people we're testing at community pop-up sites. So this also includes people who might be tested because they're coming to the hospital and the hospital wants to control any spread that might be introduced at that point. So with that, I'll come back to just final remarks. In my moment of gratitude today, I'd really like to thank school officials. I'd like to thank everyone from our school districts to our private school community to our college community. There are so many people who have worked tirelessly all summer trying to figure out how to educate every single one of our community members at whatever level they are. There are special ed teams, there are general education teams, there are college teams, there are principals, other administrators, lots of teachers, lots of people dedicated to education. And we recognize this is a really hard time. I'm a parent, just like Ramona as well, and Terry, and we also recognize how hard this is for parents. It is a very difficult time for everybody. And so I would just like to thank all of you who are working hard to try to provide the best evidence-based options for our children as we return to school. And that includes all the people who are preparing the physical building, all the people who are preparing to serve food safely, working with our sanitarians. Like there are so many people that are behind the scenes that have been working really hard, and we thank you, we thank you, we thank you. And finally, I just want to really almost give a plea that this is really hard. It's going to be a long time. This is not going away anytime soon. And again, we're not trying to be a downer. We're not trying to be, fearful in any way, but we do recognize that this is a long haul. And we're only going to get through it if we do this together. And that includes being kind to one another and really respecting each other. Tough decisions are being made. and they will not make everyone happy. We understand that, but we are doing our best to share the best data we can, the best science and evidence we can. And we would hope that everyone would at least, if you don't agree with the decision that's being made in whatever sphere of influence you're in, please at least respect others who are trying to do what they can. And please at least share your opinion in that respectful manner. Kindness and gratitude are going to be what got us through this. And I'll continue to say that as long as it takes. We're here with this community for the long haul, but we really need your partnership. We've got to do this together. So with that, I'll turn it back over to Devin for questions.
Thanks so much, Dr. Gullett, and thank you, everyone. We now have some time for a few questions. Just a reminder to please unmute yourself before you ask your question, identify yourself and your organization, and then after you've asked your question, if you could please mute yourself again. Thank you very much.
Hi, this is Courtney Astolfi with Cleveland.com. Can you hear me?
Yep, go ahead.
All right. I had a couple of questions about those 4 metrics that you folks talked about regarding how or when the board may change its recommendations for schools. My first question was related to that positivity rate metric. I'm trying to better understand what a sustained decline below 5% means. Does that mean that anytime it would increase, even if it's below 5%, or anytime it goes back above 5%, that you would essentially have to start the clock over and look for continued decline going forward? Just looking for clarity on what that means.
I can start off with that question. Thank you, Courtney. So yes, this is, we've had a lot of internal discussion. What we do know is we've been talking with our partners from other counties and large counties, as you know, around the state. Many of them have made similar recommendations. There's some variation among them as we all try to do our best to make determinations in very uncertain times. And so what we want to see when we say sustained is over multiple weeks, where we know that we're not seeing this fluctuation where we're 5% and then the next week we're up to 7%. And, you know, getting a sense that we are on a clear trajectory downward below 5% and sustaining that. We do know from data earlier this year that these percentages can change quickly. As Dr. Gullett mentioned, at one point we were at 9%, and that happened over the course of 3 or 4 weeks. We went from 3.7%. I remember this distinctly in mid-June to mid-July. We went from 3.7% to 9%. And that was became a very much a concern. So I think the masking is helping. I think we want to see this idea of a sustained decline, a continued drop over multiple weeks below that 5% threshold, so we know that we're sustaining it. I know that, for instance, New York City made determinations on recommendations for in-person schooling because they were sustaining a 1% positivity rate almost across the board among everyone tested. That's fantastic. It would be great if we could get there and sustain that type of positivity rate so you'd feel comfortable that we have a good level of protection. But we want to see us move below 5% and sustain that over multiple weeks. We also want to see that orange rating, as I described, sustained over multiple weeks below or at orange and not fluctuating back and forth between orange and red. And we have seen that among counties, as you've seen the reports from the governor on the weekly public health advisory system. And then the other piece is, I mentioned the case reports. We're still coming down from what was a peak in mid-July, high in the 900s, and we're now just under 600. We're coming from great heights. And so that movement is very promising, and that continued drop, we're going to continue to watch. The last piece is the testing piece, and that is very much a work in progress. We need to see that testing capacity in place to help us understand and diagnose when we're seeing outbreaks and having positive cases, then work from to identify close contacts so we can make decisions about isolation and quarantine. We were having those difficulties in March, as you'll recall, when we did not have the testing capacity. And so you're basically working with symptoms. If you're working with symptoms without any confirmation, as certainly Director Brazil and Dr. Gull can tell you, we're going to have to err on the side of caution. If people have symptoms that are consistent, here we are in the flu season coming forward, and people have symptoms that are consistent with flu. We don't know if it's flu, we don't know if it's COVID. And so we've got to err on the side of caution to protect kids, to protect staff, to protect families. So these are all factors that we need to consider. And we think that collectively, as we know, the rating system, Orange, is based on a range of other metrics, many of the clinical metrics that Dr. Galt described. So we want to continue to talk with our partners, continue to review the data to make the best decisions. And in the meantime, we know schools have made decisions that they think were best for them in what are very difficult times relative to sports, extracurriculars, and their actual plan for curriculum delivery.
Hey, thank you. And that testing capacity for children was my second question today. Are there efforts underway by the county, the Board of Health, the state, to boost that testing capacity for children? What progress is happening there, if any?
Thanks, Courtney. This is Dr. Gullett. I'll take that. So it is, we have made it very apparent for months that this is a challenge. It began to be a challenge back in March when there were still daycares that were open under the emergency orders. There were certain daycares that were open. And so we have been dealing with testing challenges in children since March. We at the Board of Health and our team, our community strike team that we deployed for testing was comfortable testing kids. And I have distinct memories of testing newborns in March when we had a congregate situation with positive individuals. So we have been doing our best in outbreak investigations and cluster investigations to test children, but it's a very small volume, and it's not been something that has been able to be scaled. So we have shared this with the governor, we've shared this with our state colleagues at ODH, we've shared this with all of our hospital partners, and in fact can continue to talk about it multiple times per week. So everyone is doing their best from the hospital lab perspective to try to increase that capacity. But we don't have a lab at the Board of Health, and we don't have a capacity for large volume testing. So at this point, we're handling things on a case-by-case basis and trying to do what we can in cluster investigations that involve children to get them tested. Our community health centers have stepped up in a remarkable way in order to offer some pediatric testing availability, but they also are not labs. They are simply people who can order the test and collect it, but it still has to be run at one of the hospital labs. So, you know, I don't have specifics. I wish I did, and I will celebrate the day I can come to you, Courtney, with you know, good news about we have this much more testing available, but I can just at least reassure you that there are a lot of people working on the situation, but it's a problem across the entire state. It's not like it's limited to our community. We just have a large volume of children here.
Thank you.
Thanks, Courtney. We have time for one more question.
Hi, this is Layla Tassi from Cleveland.com. My question is well, it's multi-pronged. It might be for Ramona or Terry. So when looking at school reopening plans throughout the county, it seems that they get a little murky around the question of whether parents will be notified when a student in their child's class tests positive for COVID during in-person learning. A teacher in one district told me that during a training session this morning, school officials said that the district would rely on contact tracing done by the Cuyahoga County Health Department to determine which classmates of a COVID positive student are actually considered to have been in close contact, and that only those parents will be notified of the positive test rather than all the parents in the class. And she said that county contact tracers would rely on 3 factors in making those determinations: whether the child was within 6 feet of the infected student, whether they were wearing masks, and whether they were indoors. So the question I have is first of all, is that criteria for identifying a close contact accurate? And I know that districts are making their own decisions about parental notification, but they clearly take guidance from the health department. So is it the health department's position that a positive COVID test does not necessarily warrant notifying all the families in that particular classroom? Would doing so run afoul of FERPA, given that it would be pretty easy to figure out which student is absent? And then the final question I have is, how long do you expect contact tracing to take on cases that arise in school from the time you get word of a positive test? How long would it be before other parents are told that their child might have been exposed and have to quarantine? I know there's a lot there, so I appreciate your time.
Ramona, would you like me to start off? Or would you like to? There's a lot of information. How would you like to go? Okay. All right, I'll begin and Ramona can jump in. So thank you for your question, Lila. I'll try to take some pieces of that. So as I mentioned, we've been doing trainings and talking with the school districts from the beginning. Actually, since graduation, we've been meeting with them. And so trainings around food safety and environmental health and safety, and also around contact tracing. So that's, I think, forthcoming, a session we're having with schools, working with our public health nurses that Ramona oversees to make sure that we provide the guidance. The first thing I will say is that we're going to rely on schools to help us with contact tracing. I mean, who better to understand where the students or staff pathways have been, or where a coach may have been in a school environment, than the schools themselves. So they've very much embraced that role of helping us to understand who those close contacts are in the school environment. We can certainly rely on parents related to the home environment as it may relate to a student. And so that is, they are very much partners with us in that regard. And then in terms of looking at close contacts, there will be, as you say, it's the 6 foot distance is certainly important. And the sustained 6 foot distance, certainly the guidance applies universally for schools or any other situation. 10 to 15 minutes close contact, face to face. We know that cloth masks help, but they are not personal protective equipment. They can substantially reduce risk, which we know and have seen certainly in the work we've done to date. But we're going to assess that as well. We know that from past experience, the primary, when we see it in a case, usually the secondary or related cases first start to come from home environment, but it's not always true. It depends how much traveling a case may do, whether they're a student or anyone else. Are they moving around the community at parties or with friends? Do they spend a sustained time on a bus? Are they wearing their masks on the bus? So I think the complexity can vary substantially between how long it would take to do the tracing based on several factors. The first one would be how much traveling and interaction does the student or the teacher or a coach, for instance, have over the course of the risk period. And then the other piece is, not just understanding that, but understanding the interrelationship within the school on those interactions. So we hear lots of different, versions of stories, and the piece that I wanted Ramona actually to talk about, if she would, she mentioned it earlier, and I think she provided great context around cooperation, because that is that's a big gap certainly for us.
So yes, I would agree about close contacts. They can get a little bit complicated. It's not extremely straightforward, but yes, we would be looking at what was the distance between students, what was the amount of time that they were around each other. The classroom in itself is the way that we would look at it, but as Terry mentioned, we would also look, do they ride the bus together? Did they spend time outside of school together? All of those things will become important in understanding who may be at risk of transmission of COVID-19. We would provide to the school different tools that they can use to help communicate to the school community about COVID-19 transmission in the schools. It would be up to the schools to decide how far beyond the student and those initial contacts to inform the school body. I think that we should have an understanding that there are going to be cases in schools. And so, do you want to send a letter every single time to everyone? I mean, there may be a point where it is commonly in the school. So that may not be the most effective way of managing that. It'll depend on the school and kind of what's going on at that school. But we will work with them definitely with that. We always have concerns about privacy. Privacy is very important to us. I'm a registered nurse myself, so maintaining someone's information is something we guard very closely. It can become difficult, especially if there are a few number of cases, to not be able to say, well, who are you talking about? If you send a letter, or if there was a team and someone isn't participating anymore. So we are very careful in how we discuss that with the school, or with, we would want that to be with the student body, but so that's something we would be careful about, but how they choose to communicate will be up to the school district.
Okay. And as far as the timing of how long it takes to do contact tracing, it sounds like there are a lot of factors that go into that. But could it be a situation where days are passing and students remain in the classroom who should be quarantined?
So, we, just the same way as we take a case that's reported in a nursing home, we would do the same thing for schools. We are very concerned about transmission in schools. And so, even with a few cases that we've already dealt with, contact tracing starts the moment we're notified of a positive case. They all seem to happen on Saturday evenings. I don't know why, but they do. But we immediately start. We contact the family of the confirmed case. We try and find out. The school generally is already working on helping us to identify who that student may have been around, or staff member. And then we're immediately moving into contact tracing. So, the important thing, and this does go with the cooperation as well as, the disclosure, is, we want, so once that student, most likely will know about the test result because we'll get them from the lab. But, every once in a while, the student will inform the school or the staff member before that test result has been reported to us. So in those cases, we want people to immediately go home, isolate. They can start by helping to identify who was around that person, notifying, friends and other family members that this person has tested positive. And that way, when we get the information either from the school directly or from the lab, we start calling, which we will do, then, people have already started to limit their exposure. So that's a very important part of trying to minimize the spread.
And I would like to add just one more thing that the public can do to help us in this situation is that if you think you have COVID-19 and you have gone to get a test, or you've taken your child to get a test, please isolate between the time you have the test taken and the time the test result returns. We have countless examples of people who think they have it, they go and get tested, and then 3 or 4 days pass until their result comes back, sometimes longer than that, depending on which lab. And they have literally been all over town, have had hundreds of exposures in the interim. So one of the things you can do is please don't go to practice. Please don't go back to school. Please don't go out to the store. Please don't go socialize with friends. Literally, you need to come home and stay isolated in your room, away from your family and away from everyone else until that test result returns. That will greatly help us with contact tracing. And that's something that we haven't seen that folks realize they need to do after they get tested. And that counts for everyone, not just students.
Mm-hmm. Has the county hired additional contact tracers in anticipation of the reopening schools?
I can start off with that. So we've trained internally about 75 people. And Ramona has been key in a lot of that training, using certainly state level and other recognized training materials. And we certainly have a lot of experience at contact tracing, given our numbers at 10,000 of actual cases. So we've been training all of our staff, cross-training, so we have the ability to surge. We're also working to a number of contractual arrangements to identify additional staffing capacity as we plan for the fall, along with other technology to help to perhaps ease our use of tools as we collect data and information on cases. So these things are in the works. And so yes, we need to have the ability to surge, to respond. I think the testing capacity is huge because, you know, and if we run into the fall and kids have allergies, right? And so they have a runny nose. So you have a runny nose and maybe you have a headache and, you know, so, or you may have, you have a cough, perhaps that's related to your runny nose. You know, is that COVID? If we can't test to make that determination, it may just be a seasonal allergy. And then we've got to err on the side of caution. We've got to suggest that people isolate and perhaps then start to look at their close contacts, and we are having to make difficult choices. So this testing capacity and current lack of it to respond to outbreaks to the degree necessary with schools opening can create some blind spots. And that is just an example of something that we're concerned about.
Thank you, Layla. We have time for one more question if there's any other media organizations that had anything.
Devin, if we don't have another question, Devin, I wondered if Ramona could talk about our vaccination pods we're doing for kids. They're helping them catch up with their seasonal, I should say their vaccinations. There have been drops in vaccinations among children because of COVID. It's affected vaccination rates, and Ramona's been working with the team to help kids get caught up.
Yeah, so this is, you know, typically the time in which we would have back to school vaccination clinics. But of course, COVID in itself has posed some interesting challenges in being able to do it in the traditional way that we've been able to do in the past by having clinics and having folks come in to the building and have it done. So we've started last week with back to school vaccination clinics that are set up in a drive-through fashion, targeting kindergartners as well as teenagers. We do not want kids to get behind on vaccinations. We understand that a lot of child checks and kind of routine normal appointments were canceled or pushed off in the spring. But it's still important that kids get vaccinated on time to prevent other types of vaccine preventable diseases. So we will be having these clinics, and we can send out what the schedule is. I don't want to go through all the dates, but some will be at our Board of Health location, I think once our parking lot is fixed. And then through several community locations located in communities where we already have concerns about vaccination coverage rates. So it's modeled similarly to how we've done COVID testing in the community, because we know that we can provide COVID testing in a safe manner. And now we're looking at using that same model to provide vaccinations in a safe manner.
Thank you, Ramona. And I know this is an issue that certainly is near and dear to the heart of the county executive. He's been interested in childhood vaccinations and concerned and has been asking about how COVID has affected our children and their vaccination rates. So we're trying to be responsive in that regard to do what we can to try to help kids catch.
Thank you for doing that.
Great. Well, thank you so much, everyone, and thank you very much for your thoughtful questions. That concludes this week's media briefing. So I hope everyone has a wonderful weekend, and thank you so much.